Good morning, everyone. My name is Francis Chikuse. I'm a Senior Technical Officer for Public Health Policy at Africa CDC. I'm based in Addis Ababa, Ethiopia. So today, I'll take you through the journey which we have traveled in assisting countries to develop their costed national genomic strategy document. I'll give a brief overview of Africa CDC. As we are aware that Africa CDC was launched in 2017, and then in 2020, we also had Africa PGI Pathogen Genomics Initiative, which was also launched in response to COVID-19 mainly. And then I think my colleague on Monday also mentioned now that we now have PGI 2.0, which was launched in Zambia in 2023. So in 2024, also there is discussion to have also to launch Africa CDC Institute of Genomics, which also involve human genomics and precision medicine. And I think this is also very key because as we have seen in other countries, they are also advanced in terms of their human genomics and also precision medicine in addition to pathogen genomics. So the capacity for genomics has been increasing within the continent. As you can see from 1829, 48 countries, they had no NGS capacity in public health laboratories. But for 2023, we now have countries which have got increased capacity with also centers of excellences. And we hope that by 2026, no country will be left alone. My presentation is going to be made easy because most of the aspects they have been already been shared with previous speakers since Monday. But how then do we integrate genomics within the existing systems in Africa? What are the lessons learned? I think the why part has always been explained. We need to enhance our public health systems. We need to enhance our emergency and preparedness, and also the surveillance system, and countries which also have human genomics. Then I'll move on to the way. We have been working with 21 countries so far, which we have assisted, and some of them we are continuing to assist them. And most of these countries, they are in white. In the northern part of Africa, central part, eastern, western side, and also the southern African region. So the way which we have been conducting, we have had a stepwise approach where we started with a regional workshop, invited 15 countries. That was in Lusaka. And then we wanted countries to share their experiences and also to build some community of practice, because we realized that countries, they have common problems. So they also have to have solutions. Then after the regional workshop, we'll also now conduct individual countries. We started, like I said, 15. And then we emphasize the need to have a collaborative approach to genomics, also vis-a-vis addressing the real challenges. And I think we have had a lot of valuable lessons. Initially, the approach was the One Health approach. We invited the One Health ministries. But as we realized, as we had a lot of consultative approach within member states. We also realized that even the police, they were also involved in genomics, and they were also involved in development of these national strategies. Mainly, they are also involved in forensics, and also to address one of the critical problems in terms of supply chain, the customs. We also had to involve the ministries responsible for customs, and for obvious reasons, the Ministry of Finance. And I think there we learned valuable information, because some ministries, they only thought genomics was for COVID-19, and it was there. But after those meetings, and then they are away. And then we, during this development of these national strategies, we're leveraging on two valuable resources. I think the first one has already been the global one by WHO has already been presented to you, but it was also a good resource. Then we also have the continental one, the Africa CDC Pathogen Genomics Surveillance Policy Framework. And this document was very, very crucial because, one, it was validated by more than 40 member states in the Africa. So they gathered together and validated the document to say, this is what we want for Africa, and this is what we want to include in our national strategies as well. So the continental one, it has got 7 priority areas around capacity expansion, which has already been mentioned, as well as workforce. Not only the development, but what was also key for the continent was also the retention part, and also the leadership, coordination, and governance. And I think we have heard from a previous speaker from Pakistan, then they had to form the National Genomics Consortium, and also all these member states which you have assisted. Another area which we really assisted them was to form this National Genomic Consortium, and also the framework, how they are going to work, what are the roles. And this, the consortium also has got different stakeholders, with each having different roles. Another key priority area also was on supply chain and also access, including financing, and putting more emphasis on domestic financing, and lastly, on data governance. Like I said, I will not dwell much into the global genomic surveillance strategy by WHO. It has got 5 objectives, and I think they have been shared with you. But what came out as key during this process was to have the guiding principles for these national strategies. And the most key one, which were also emphasized, was the ownership. Countries, they took the ownership. When we went there for in-country workshop, they were the ones who were doing the facilitation, the ones who were doing the moderation, taking charge of the development process. Us as Africa CDC and also key partners were also there. We were only there to provide technical support. So this is where the ownership started. And then we even emphasize that these are the national documents, not even for us as key partners. And then also other key guiding principles, which have also already been shared by my colleagues, is also this strategy has got mainly the public health focus, and also multidisciplinary partnership, issues around equitability, as well as sustainability, data governance, One Health approach, and emergency preparedness. So what has then been the impact of Africa PGI? So since 2024, 6 countries have developed, finalized, and launched their national strategy documents. And I think some of these countries that are here, I've seen representatives from Malawi, they have launched. Recently when Mozambique, they launched on the 3rd. Ghana as well has launched, Nigeria has launched, Ethiopia, I have seen also some colleagues from Ethiopia, they have also launched. And then we also have 11 countries who have finalized, and they are now going through the processes in terms of launching. And then from that list, I know very well on Monday this week, Rwanda has also indicated that they want to launch on the 11th December. But in between that, I expect we are still working with the other countries to also launch their national strategies. And then we are still working with 4 other countries to finalize their work. And that's a picture just to show the Zambia National Genomic Strategy document, as well as the consortium framework. These are the meetings, various meetings which you have had, regional workshop involving many countries, as well as the in-country workshop. So, what has been learned? The first one is coordination between regional bodies like Africa CDC and other in-country partners like Global Fund, WHO, US CDC, CHI. They are very, very critical to develop a robust and a comprehensive national strategy. In all the in-country workshop, we would make sure that all those partners were also there to provide support to the member states. What is also key is you have to ensure that you maintain strong national leadership and also good political will, with also politicians, as well as key ministries, like I've mentioned, that we have to have a number of ministries involved so that we can have buy-in at an early stage. This national strategy, mainly they focus on public health, decision-making, and target all the priority pathogens, whether at national level or at regional level. And there is need to strengthen data management and promote data sharing and collaboration. There's need to strengthen coordination, and I think I've mentioned that this is mainly through the National Genomics Consortium, which has got various technical working groups, and also to conduct situational analysis and SWOT analysis, and I think that has been also mentioned, and also having clear objectives, missions, as well as an approach for strategic implementation. This is very key. And you need to come up with a costed implementation plan, which has got timelines and also those people who are responsible, as well as robust M&E frameworks, and also resource mobilization plan. So in terms of the target for implementation, these are the key areas in terms of the capacity. And I think after the situation analysis, we have realized in those countries which we have working with them, 21 of them, mostly now, in terms of capacity, mostly have got sequencers. It's no longer a gap. But they still have other areas where there are gaps, like in terms of also data storage, and also even the workforce development. We need to target various actors, not only those who are working in the lab, but also in terms of how can epidemiologists be trained also within this genomic work, as well as the policymakers and also the leadership, because these are the key people who are going to make policies. So in all our trainings, there are also going to be also some work and activities aligned to that, as well as supply chain. I've mentioned that they need to conduct the customs official. What we have learned in most countries is in terms of supply chain, the issue of customs is the major challenge. In some countries, they are tax exempted. They don't pay any tax, but the process is very cumbersome. It may take 3 or so 4 months before those whatever you have given the countries they are cleared. And then in some countries, they still pay a lot of tax. I remember one of the countries during our MPOX response, we gave them reagents which were worth about 100,000, but they were required to pay 110,000 US dollars in terms of tax. So these are some of the issues which now when the countries engage the right authorities dealing with customs, these are also discussions which, how can we minimize the time for clearance, and also what can we do about the issue of exorbitant taxes on laboratory commodities, including genomics. And I think also there's a huge gap in terms of quality management systems, and I think a lot of countries, they have taken cognizance of that. And then in terms of data governance and domestic financing. So as Africa CDC, as the next steps, we want to ensure we assist the 4 remaining countries to finalize and also launch their document, and also for the 11 countries, they also to assist them to launch their national strategies. So these national strategies, they are anchored on the sustainability as core for development, and this is something which we have always been discussing, and it has been addressed, and we will continue working with countries to make sure that sustainability is also, the issue of sustainability is also addressed. But one of the key gaps which we identified during the development of national strategies is when it comes to costing. The available tools which are there, one, they are not meant for multi-pathogens, and 2, as a continent, they don't address our key supply chain issues. For example, as you are aware that in Global North, the cost of doing genomics is lower. So when you do the costing in the continent, we also have to factor in that in terms of the actual cost. So I think going forward, if we can have, we can work with other key partners. We have got experience in developing the genomic costing tool for multi-pathogens, specifically for the continent. I think it has been mentioned that we need to move towards domestic financing, and I'm glad to say that it is something which Africa CDC has been taking it seriously. Now, recently, there has been a world division which has been formed solely to support member states in how can they come up with this domestic financing for health. They also, so Africa CDC has developed a simple yet powerful booklet titled Rethinking Health Financing in the New Era. And this booklet provides clear guidance to African Union member states on how to rethink and strengthen the health financing strategies. It is also anchored on areas like policy research and advocacy, the economic modeling, strategic guidance, as well as innovation in financing, including the blended finance, and also how can we tap also into other innovative financing models like the diaspora bonds. And I think one of the issues which came out clearly, what also other countries they are thinking in terms of increasing the domestic financing for health, they call it the syntax. This syntax is taxing on goods like alcoholic beverages, cigarettes, as well as sugary foods. And I think, yeah, this is also one thing which we have also learned. I would like to acknowledge the National Public Health Institutes, National Reference Laboratories, who are very instrumental to make sure that we have a coordinated, collaborative approach in developing these national strategies, as well as the funding from the World Bank and also the Gates Foundation. I thank you.